It's Movement Cube Monday, and this month we're going to do a photo, videography, or anyone that lugs a camera around series. So each week we're going to give you a couple things to fix any of the back pain or headaches or shoulder pain you get associated with doing movements that are going to get the shot, which are going to be something like this, or this, or this. We're going to start with the back because I don't think I've ever met a videographer or photographer who didn't have some sort of back pain. So here's a few movements that can help with that. First is going to be open book, which is going to help with that tight spot in the middle of your back that pretty much everyone you know has. What we're going to do is bring the knees up to 90, go on our side here, and from here what we want to do is just open the book. We'll do a couple sets of 10 on each side with this. And if you want to make it more aggressive, what you can do is use the top hand to grab the bottom foot, and then just work the shoulder back as far as you can. Same thing with this, it'll be a couple sets of 10, and you should feel this a little bit more in the back and maybe even a little bit in the low back. Next we'll work on the low back. So what we're gonna do is a seated QL stretch. What you're gonna do is take your foot, bring it up over your knee. From here, you wanna lean forward and to the side, sort of taking your face towards the foot. Have your face right over the ankle, and then you're gonna take the hand on the side that the leg is crossed, and come up and over as far as you can reach, and we'll do a couple sets of 30-second holds on this one for each side. And last, after we've done some stretching and calm that down, we're gonna add some strength on top of it. We're gonna use a bird dog for this. So what you'll do is go on all fours. We're gonna go opposite arm, opposite leg. So if we go right arm, we'll use left leg. Straighten both of those out, and we're gonna hold for about 10 seconds. We wanna focus on not rotating to either side, trying to stay stable here. And we're gonna repeat this for 3 times 10 seconds per side. So go ahead and give these a shot, because if you can fix yourself, you should. And if you can't, we're here.